do take into account as much as possible the complex and sophisticated understanding of three main elements: mind, brain, body. In short, I'm saying mind therapists have to learn how to work with the whole person. Perhaps we might describe that as working with an embodied psyche. How do we enable the well-being of the whole person while engaging primarily with the mind? I find that patients who seek out therapy for emotional and mental distress and stress often come with either diagnosed or even undiagnosed physical ills. Valerie Sinison observed that in the past, as analytic practitioners, to cope with the privileged access to mind of the client, with this tremendous focus on mind, a split's been made that excludes the body. That just doesn't work any longer. Some have chosen to develop exciting new therapeutic techniques. I know there are some Jungians in the audience today, and they'll think of authentic movement. And we've seen the richness that sensory motor therapy has to offer. But I encounter some patients who remain far too frightened to approach issues concerning the body so directly. What about those patients who will specifically choose a practitioner for their expertise in dealing with mind? I want to think about two groups of patients in particular: those with a diagnosis of physical illness, who have specific difficulties to contend with that deeply affect their experience of themselves and their sense of wholeness. One struggles with the acute, perhaps onset and treatment of cancer. Another with the chronic, in the form of diabetes, epilepsy, MS, ME. Yet another, the very particular challenges occasioned by terminal illness. Others who ask for help may be seeking to come to terms with illness in a loved one or the loss of a loved one. Most challenging to identify are those who engage in therapy with undiagnosed organic illness of which they're unaware. And I'm a lay therapist, I'm a historian, I'm not a medic. I've had 2 patients with brain tumors arrive in my practice over 30 years. And fortunately, with both of them, within 3 to 4 weeks, I had been able to realize that the problem was something which needed another approach alongside psychotherapy. Both of them ended up having surgery. It's a warning. You know, we do need to be careful not to attribute everything to mind alone. And the group that I'm particularly interested in, and we all are today, I think, is those who've experienced early relational trauma. They carry the marks of that experience in their being, in their bodily states of being. Filitti comments, traumatic events of the earliest years of infancy are not lost, but like a child's footprints in the wet cement, are often preserved lifelong. He emphasizes, time does not heal the wounds that occur in those earliest years. Time conceals them. They're not lost, they're embodied. He warns that if we don't explore how to work with this, we ignore what is actually the somatic inscription of life experience onto the human body and brain.